right. Hey, good morning, everyone. It's 8:33, so we're going to go ahead and start this meeting officially and expect that there'll be a few people jumping on as we're in progress. So let's see what we've got today. Let's see if I know how to move my screen. There we go. All right. So here's what we can expect today, as usual. At our UCCCN meetings, we'll start with some introductions, and we've got a few announcements and updates to apprise you of. And we always like to take some time to talk about whatever's going on in your worlds with cases and any new resources you may have come across, any quality improvement things you're doing, any motivational interviewing opportunities you've found. We love to crowdsource and brainstorm and just bring the resources of this fantastic group together in all those ways. So that's your time, and we hope you'll take advantage of it. And then we are going to, as our main topic today, do a hands-on exercise using the Medical Home Portal. And we did this last year and had a lot of really positive feedback. So we're doing it again. And we hope that you guys are all on a device that will allow you to feel really interactive so that we can see and hear you, we hope. And you'll also be able to access the Medical Home Portal, and it should be a lot of fun. The goal of this is to have a good time and learn a little bit more. So no pressure, just fun. And then we'll wrap it up by 10 o'clock. All right, so we'll start with some introductions, and I always try and do this by just looking at who's on the participant list on Zoom and going down. Sometimes I don't do that perfectly, so I'll ask Michelle for her help. And if you get skipped, just holler. And you can holler in the chat if that's more convenient or easier for you. You're very welcome to introduce yourself via chat. We'll just read that out loud. So whatever you want to do when I call your name. So I'm Mindy Tueller, and I am the Director of Operations for the Medical Home Portal, as well as the facilitator for this group. And for those of you who might be a little newer, this group has actually been going on since January of 2015. So we like to recognize that this is a long-standing, but also fairly informal group of mainly pediatric care coordinators, really anyone who is involved in the care coordination around children, and particularly children with complex and chronic conditions. But we welcome anyone and everyone to these meetings. And so we're so glad that you're here. All right, so I'm going to look at the participant list now, and Michelle's next. So hey, Michelle.
Good morning. I'm Michelle Redfield. I'm the Administrative Assistant for the Medical Home Portal and UCCCN and General Pediatrics.
Thanks, Michelle. We couldn't do this without her. Next, I see Amalia.
Hi, hopefully you can hear me okay. I am a project coordinator with UDAC, and I work alongside the UPIC team.
Welcome, Amalia. And Amber Rose.
Can you guys hear me? I am an ISP care coordinator for San Juan County. So, yep, I love my job. This is awesome.
We're very happy that you're with us, Amber.
Thank you.
Please join whenever you can. That's terrific. Thank you.
All right.
All right. Okay. Next, we've got. Sorry, I have too many things open. Oop, go back there. Close that. Here we go. Maybe not. There we go. All right, Tony. If you're able, Tony, and feel free to put in the chat too.
Hey, sorry. This is Tony with Integrated Services Program. I'm a care coordinator, and I work in the Ogden office.
Great. Happy you're with us this morning, Tony. Athena.
Hi, I'm Athena Parker, and I work with Medical Home Portal as well as the Support Services Manager, and help support some of our state partners in the Utah directory.
Wonderful. And you guys, Athena has just moved to North Carolina, so it's a lot later for her than it is for us. Maybe that means she's got more brain power this morning. So that'll be good. All right. Hey, Dusty, you want to introduce yourself?
Yeah, so I'm Dusty Frisbee with Wasatch Pediatrics, and I don't know what I am. I am now the medical home administrator here, as well as care. I also do care coordination. It's great to see you.
It's great to have you with us, Dusty. And Dusty has just a wealth of experience and knowledge, and we are delighted that she's able to join us again after a bit of a hiatus. And she's got a lot on her shoulders now, and we're really pleased that you're with us. So terrific. All right, Erica.
I'm Erica Wall. I'm a nurse with ISP Services, Eric's team. Through Tri-County Health Department, I cover Daggett, Duchesne, and Uintah counties.
Awesome. We're glad you're with us, and that's so important. Wonderful. All right, Heather Carlson.
Hi there, I'm Heather Carlson. I'm a nurse care coordinator for the Integrated Services Program, and I'm up here in Northern Utah with Tony and under Eric's group as well.
So happy to see you, Heather. We love Heather. We love all of Eric's team, and Heather was a part of it, and then took some time to go a different direction, and now she's back, and we're really pleased to see you again.
I'm so happy to be here. Thank you.
Hey, Ileana.
Hello, this is Ileana and Janet. Having problems with my computer, but I'm back.
Okay. Awesome. Okay, so we always need to remember that Ileana is Ileana and Janet with Southwest Children's Clinic. We're so glad you guys are with us. Cool. All right. Good luck with your computer. And Jennifer Goldman-Luthy.
Hi, I'm Jennifer. I'm a pediatrician at the University of Utah, and I work with Mindy and team on the medical home portal. And glad to be here today.
Welcome, welcome. All right. Hey, Julie Southwick.
Hi, this is Julie Southwick, and I'm with the Integrated Services Program. I'm their transition specialist.
Yay, Julie. We're so happy you're here. Welcome, welcome. And Natalie, you already put your stuff in the chat, but if you can unmute, we'd love to hear your voice.
So I am dog sitting, and I'm not kidding you. The dog is barking at the computer, so it's good. But I'm the nurse practitioner with Eric's team, and I love to be here and learn so much from you every month.
Welcome, Natalie, and we learned so much from you too. So we're really pleased that you're here. All right, I see that Heidi popped into my list. Ileana and Janet, I see you updated that. Thank you, guys. Heidi, do you want to introduce yourself?
Yeah, hi, I am Heidi Bates. So sorry I'm late. I had technical difficulties this morning with my Zoom, had to download again. So I am with UPIC, and I appreciate all that Mindy does for this medical home portal and our kids. So thanks.
Glad you're here, Heidi. We love UPIC. We love you guys. All right, let's see. Natalie Carter. We have a chat in the chat. Okay, Natalie Carter is with Eric's team, an ISP care coordinator in Central Utah. Fantastic. We've got, that looks like most of the team, if not all of Eric's team. That's great. All right, let's see who else we've got. How about Eric?
Well, speaking of Eric's team, Eric is finally on. I apologize between internet issues and then having to re-download Zoom. I swear every time Zoom hates my guts and asks me to re-download. Anyway, I'm Eric Christensen. I'm the program manager with the Integrated Services Program with the Department of Health, soon to be the Department of Health and Human Services at a location near you.
Fantastic. We're glad you're with us, Eric. Great. All right. And Tina?
Hi, I'm Tina Purcells. I am a consultant with Utah Family Voices. I also work with the medical home portal team on editing and reviewing the website pages.
Tina, I'm so happy to see you. I hope you're doing okay.
Absolutely.
Very good. All right. And Walt.
Good morning. This is Walt Torres, and I'm with the Integrated Services Program with Eric's team also, and I'm a care coordinator in the Salt Lake office.
Fantastic. All right. I think that might complete Eric's team in terms of introductions. Fabulous. And then we'll just do one more and then we'll get started on our meeting. Brooke Christensen.
Hi, this is Brooke Christensen. I'm a care coordinator with Utah Valley Pediatrics in Saratoga Springs.
Excellent. All right, we're so glad everybody was able to join us this morning. And if anyone else joins, that's great. Part of the reason that we do the introductions is to help you guys get to know one another, get to know who your peers are, and be aware that we are here as resources for you and each other. If you feel like you can keep your camera on, we love to see you too in these days of everything being virtual. If you don't and you can't, that's fine. We get that too, no problem. All right, now I'm going to advance my slide, maybe. And we've kind of been pushing for this particular meeting to ask specifically that you try and join via, something more like a laptop if you're able to. But just generally speaking, the Zoom experience does seem to be better if you're able to do it that way. And we'll try and end promptly at 10 and respect your time. All right, I just want to remind you about the Spark Autism study. And that if you're interested in getting materials, whether they're digital or physical, that is something that you can do to help connect your families who may in fact have a child with autism to learn more about that. Amalia, do you want to just take a second and mention anything?
Yeah, I don't think much has changed since the last time I gave you a 5-year report, and things are resuming as normal. So if you have any questions, you can contact me and anyone else on the UPIC team. Heidi also helps with this. So I'll drop my email below in the Spark email as well.
Okay, fantastic. It's a pretty cool study. And they get Amazon gift cards, which is also very cool. All right, so want to remind you guys about the Pediatric Project ECHO program that we are involved with at the Medical Home Portal. And our spring session has come to a close now. It was terrific. We had so many amazing presentations, and the slides and recordings for those are all on the Peds Echo page, which is below, and we'll make sure that that link goes out in the summary of the meeting. So we hope that if you have an interest in any of those topics, you'll take the opportunity to check out the recording of that. If you are able to attend those live, there is CME. For those live recordings, and we'll start up again at the end or toward the end of August. We'll start up again with those. And I just want to make you aware that that's the regular session. We also have the Autism 101. It's kind of like a sub-series that is being put on by the wonderful folks who are affiliated with UDAC, including Dr. Carbone and colleagues. And so these will continue through October, and they've been very well received and very well attended. And of course, they are posted as well, same place once they're complete. So this is just a quick snapshot showing you that the last one had to do with diagnostic evaluation, and the next one has to do with developmental, behavioral, and educational interventions. And yeah, they're on the 4th Wednesday of each month, and we hope that you might check those out as well, whether live or after the fact, if those are interesting to you. So rather than listing out every single newborn disorder that's gotten updated recently, I just threw in here all of the newborn disorders on the Medical Home Portal have now been streamlined and updated, which is pretty darn cool. So wanted to make you aware of that. And then we've also been working on a version of the care notebook that's all in Spanish. And if I have time, and I think I might, maybe in fact, I'll ask Athena if you don't mind quickly pulling up the care notebook while I just talk about it for a second and we can show it. The care notebook is one of our most clicked on pages, resources on the Medical Home Portal. And I think the reason it is that it's been very well done. Tina and her folks at the Utah Parent Center, Utah Family Voices, have worked on this. There was an original version that was extremely popular, and then they have gone in and updated that recently. And then we've translated that over into Spanish with the help of some terrific folks. Eric's group has helped with that, as well as some folks with UDAC. So we really appreciate all of the collaboration on this. And one of the neat things about this is that each individual page can be downloaded, and they are in fillable PDF format. So if a family is interested in using these to help track what's going on with their child's history and needs, it can be done both kind of all digitally now if they're interested in doing that, or they can print those out and take them with them. So there are more options now in that. Athena, are you able to take over or not yet?
I can't share my screen at the moment. We're trying to figure that out.
Oh, okay, no problem. I'll see if I can do it, but I probably will. I probably can't, so maybe I won't. We'll come back to that. But it is so. It is so well visited that we just want to make sure that you're aware of this. And so we'll come back and show that to you. We have various partner states who have found it and have just been so enthusiastic about it. And again, we just get so many hits to it that we know that it's a valuable resource. So we want to make sure that you're aware of that. And particularly that we have a Spanish version now. Athena's showing. Awesome. Okay. It's actually not in the taking care of yourself. If you want to just search for it, I think that'll be even a little faster. There you go. And so, of course, in many cases, we would just suggest you let your families know that they can translate a page into whatever language. But on this particular page, we try and have all of the information both in English and in Spanish. So this table, while it's quite long, does have each individual page of the care notebook. On the left is the version in English, on the right is the version in Spanish. Thank you. And then here is a fillable PDF form. And a big thanks to Michelle for all the work that she did in testing that out so that those fillable pages work. Thank you very much, Athena. That's great. Oops, okay. I'll share my screen again. All right, so next is brainstorming. All right, so as I mentioned at the top, we just want to make sure that you guys take full advantage of this. We are a very informal group here. So this is an opportunity for you to really pick the brains of those around you if that could be helpful to you in a case that you're working on that you're kind of stumped on a little bit. We also love to hear updates of cases. So if anyone wants to let us know about a case that we heard about previously and give us an update, that would be fantastic too. And I'm just going to be quiet now and let you guys talk.
Okay, I've got a subject to bring up. So this is a little complicated, but I'm going to try to walk you guys through it. Recently, the legislature has, approved, well, during session, they approved X amount of people to come, or children or adults to come off of the DSPD wait list. So that's currently happening. Families are getting phone calls with that wonderful message that they finally have services. They need to, get that coordinated and get it all set up so that their child can receive DSPD services after the long wait they've been on the wait list. There are other waivers. I'm sure a lot of you know about them. there are other waivers out there besides DSPD. The two main ones that we're concerned with kids and young adults and adults actually is the technology dependent waiver, which is a waiver for children who depend on technology to live, basically, and that would mainly be trachs and trach vents. And then there's the MCCW, which is the medically complex children's waiver, that kind of is that catch-all for other things that are medically complex. And not catch-all, because not all the kids are being caught, obviously. But so with that being said, many kids and young adults have been on the DSPD wait list, and they've been directed to do this, to be on that wait list while they're on these other waivers. Because, and what I was told with a kid with a trach, that in case he decannulates, which means that his trach would be removed and he wouldn't need it anymore, then he would be able to, you know, other families have been told, oh, as soon as you know, get off this wait list, you can go on to DSPD and everything's going to be bright and shiny. That is not the case. What we're seeing right now, and I've received several phone calls from families and had to direct them in what to do and not do, is that these two particular waivers, the tech dependent and the MCCW, are medically, they're heavy on the medical side compared to DSPD, which means that these people need skilled nursing care, which is at a different level of respite and things that you would get on DSPD. To my amazement, even some people at DSPD don't understand that it's a risk for these people to come off of these heavy medical waivers where they receive some pretty, you know, comprehensive skilled nursing services. They just figured the kids can come off and they'll get some nursing over at DSPD. Well, that's always been my wonder. And now this is happening. We're seeing families that are getting calls. They're on one waiver and they have just come off the wait list for DSPD. So, you know, I've had a couple panicked moms who have kids with trachs call and say, what do we do? Do we take DSPD? Do we? And my answer, and anybody else out there, if you first of all hear of this, have them call me, because what we really need them to do is sit down with their caseworker of the current waiver they're on and somebody who is knowledgeable on skilled nursing over at DSPD to make a real informed decision on whether they're going to accept DSPD services or not. I've been kind of out of the loop for a couple of weeks, but I have been receiving emails from people up at DSPD, and what we're finding is at least 2 now have decided that they will not receive the correct type of services they need on DSPD. So they're turning down that whole DSPD package so they can stay on one of these medical waivers. It's sad because our medical waivers do not compare when it comes to services at all. But that's what I kind of figured was going to happen. So I just want everybody to know, if you see this situation come up, either have them call me or let them know that they have to, before they sign any papers, before they accept anything, we want them to sit down with somebody from each waiver to help them make an informed decision. Because once they make that decision, they're off one, they may not be able to get back on it. So, and the big concern here is DSPD does not provide the level of skilled nursing that we use on the tech dependent waiver and the MCCW waiver. I know that's a lot of information. If you know, you want to walk through it with me at some point, give me a call. I'm off for the rest of the week for a wedding, but I'll be in the office next week. And this is an ongoing thing. We're trying to figure it out because it really it's another big gap of inequity that we're figuring out that's happening, with families. They're not able to take the big package, the golden ticket, they're not able to take it because they need this nursing. And that's kind of where we're stuck right now with that. Things are being worked on. Also, if anybody runs across a family or an individual who has decided the services in the community are not enough for them and they're going to go into a skilled nursing facility or something like that, please try to connect them with me as well.
I appreciate that information because I think as many years as I've worked with families, we've always thought, at least I have, and maybe I shouldn't speak for everyone else, that somehow these are mutually inclusive, that you can get the whole ball of wax, you get that golden ticket, as you called it, and you've kind of reached that pinnacle that you've been waiting for forever, and you get to keep everything else. So I really appreciate you bringing that up because that really helps us shed some light and perspective on, the type of information we need to be sharing with our families, and what a gut-wrenching decision to have to make.
It is. And the reality here is, the tech-dependent waiver and the MCCW have limited services. It's basically a skilled nursing respite that is the main piece, along with the Medicaid, that's not looked at by, they don't look at your income for the Medicaid. But DSPD is a much bigger package of services. It allows day programs, it allows summer programs, it allows things that our kids on these other two waivers can't get their hands on. It's not going to happen. And it's not part of the package. We have nursing and family counseling on these other two waivers. So it is really sad that these families can't take the services that they need for their, but it's being worked on. It's being worked on. We're looking more into, the fairness and the equity in this whole waiver situation here in Utah. So
Tina, what does that mean it's being looked into? Does that mean that there might be an opportunity to try and adjust the services that are coming through DSPD when someone finally gets off the wait list?
I'm not sure yet. What I do know is it's been something that people like historically, Gina Polomoney has talked about this for years and years and never bent the ear enough of someone. I've been doing the same thing for years, and I've got a stake in it with my son. I really, want him to have better services as well. But now we have a few people within the Disability Law Center and I do believe the Department of Health and Human Services both looking at this little population that is not receiving equitable services. And it's a big deal. It really has to do with the ADA and the law. And it's just never been, we've kind of been pushed off in that corner of they're taken care of, they've got nursing, but there's a lot more that should be happening. So, like I said, it is being looked at. I think, the Disability Law Center is really interested in some of these cases. And so this is ongoing. And when I have more news, I'll let you guys know.
Okay, thank you. Has anybody encountered this yet in a family they're working with?
I think they're all coming to me, honestly. I'm getting the calls and it's somehow they're being routed to me because they're medically fragile and tech dependent. But yeah, just as long, the main thing is don't sign anything until you've made a good, informed decision.
Well, and this sounds really negative, but most of our families are waiting for everything. So we haven't had, coming to that decision crossroads for a lot of the families that we work with. So anyway, yeah. I really appreciate you sharing that this morning. That's just, it's such important information. Thank you so much.
You're welcome.
Yeah, thank you. Okay, so takeaway is have them hold off on signing anything and get in touch with Tina and Utah Parent Center, and ultimately needing to talk to the the caseworker on their waiver, and someone with skilled nursing understanding from DSPD.
Perfect.
Okay. Thank you. Anyone else want to bring something up?
Mindy, can I just do I'm going to try and make it quick, just a quick share. We've been working on Maternal Child Health Block Grant. If some of you don't know, Maternal Child Health Block Grant brings about $6.5 million into the state. 30% of that must be used for children with special health care needs. So a lot of those monies of that 30% come into integrated services so we can fund our local health department staff and provide care coordination services and our very limited clinical services that we provide through ISP. Also helps to fund the Utah Children's Care Coordination Network, partially fund our portion of Utah's side of the medical home portal. Some money goes to Utah Parent Center and some other folks that we partner with. So a lot of really important work takes place with our portion of that funding that comes into the state. As we've run stats this year, I just wanted to share what I think is some good news. We report information that feeds out of the National Survey of Children's Health. For those of you who are not familiar with that, it is a survey instrument that takes place every single year. There's an affiliation with the Department of the Census, and they survey families across the nation. It's a random sample. I almost want to say a sample of convenience, but they call households and they determine if families have kids, and then there's a screening questionnaire to determine if any of those families have children who meet the definition of a child with special health care needs. And we are right around the 16-ish% mark in the state for children with special health care needs. Nationally, it's somewhere around 19%. And I'm going to tell you that number is not static. It moves all over the place, depending on the families they reach each year. But we're looking at a 2019-2020 combined data set for this information that we're looking at. And they generally have a relatively small sample size. So that's why they like to look at 2 years of data. So as we look at that 2019-2020 data set, we got some projections, and they basically said, as they surveyed families, that, let me pull this up really quickly, but they said that 57.2% of families that they surveyed indicated that they were receiving the services indicative of a comprehensive medical home. Now, when you look at the fact that you want 100%, and you never get 100%, but 57% is amazing compared to the fact that we were like 40.4% the year before. Now, I'm going to say, I always take these surveys with a grain of salt, because it's not like you survey the same families year after year and you say, oh, we're getting, increased, people are saying that the practice where they go is getting better and better and better. But to a certain degree, we're really excited about that information. And I just want to tell you what that means. 57.2% of the population said that they have a personal doctor or nurse. They have a usual source for sick care. They receive family-centered care in that practice. They generally don't have problems getting needed referrals, and they receive effective care coordination when needed. And it says basically, to qualify as having a medical home, children must meet the criteria for adequate care on the first three components. So personal doctor, usual source of care, and family-centered care. Additionally, any children who needed referrals or care coordination must also meet the criteria for those components in order to qualify as having a medical home. So when you look at how they discuss the survey data, that bodes very well for us here in the state, and it's a huge leap and bound for us. Our statisticians ran some statistical regression analysis through SPSS for us to help us be a little bit better educated on how we're going to forecast that for the next few years. And based off of this good progress, we're anticipating that we're going to stay up in those high 50% ranges. So I just wanted to give a shout out to all of you for the excellent work you're doing, providing medical home comprehensive services effective care coordination, culturally and geographically sensitive care for the families that you're serving. So just wanted to point that out. Now, on a slightly different note, transition to adult services, we got a long way to go. We were kind of down around like 11 or 12% of families reported that they received services necessary to make transition to adult healthcare. However, with all the amazing work that is going on with all of our partners in the community, I am very confident. I'm going to put on my Pollyanna hat right now, but I'm going to say that I'm very confident that over the next couple of years, we're going to see those numbers soar as well. So anyway, just my shout out to all of you for the amazing work that you're doing. And I'm proud to be affiliated with this group and excited to continue to work with you as we move onward and upward, providing excellent care for the children and families that we serve.
Thank you, Eric. Oh, that is good news. And I underscore what Eric just said, that's because of you guys. So wonderful, wonderful. All right. Okay, well, if anyone else has a case or something they'd like to bring up, I don't want to move on too quickly.
I have a case, Mindy, but I have a new resource I added yesterday that I think people would be interested in.
Okay, great. Should I search for it?
Yeah, it's called ABA Services of Utah, and they are a new ABA provider down in Utah County that focuses specifically on ABA therapy for children transitioning into adulthood. So that 14 to 20-year-old age group. So it's probably best if you search it in the directory. And something there.
It's brand new. Okay.
Yep. If you just type ABA, it should be the first listing.
Very nice.
And they accept Medicaid. That's what they said on their website. I don't know exactly what that means, but that's always exciting. So
very good. Okay.
Ages 14 to 20.
Yeah. They're focusing on that transition into adulthood age group. So
they're
very nice.
Opening a new transition to adulthood program, like a clinic specifically for transition at Sugar House. A couple of our med ped stocks are starting it up. So they just announced today that they're going to be doing that on Mondays, a couple of slots on Monday, I think it was Monday mornings, but they're going to have referrals for that. And so more coming on up. That's exciting.
Oh, I love hearing this. Okay, there you go, Eric. Transition.
I'm excited over here. That's amazing.
Very good.
Yeah, that's definitely a positive. And we know it's kind of a pilot at this moment, but terrific model that we hope will be replicated across the state.
All right, well, let's move to the next part of our meeting. And we're gonna do our exercise using the medical home portal. So what's gonna happen now is Michelle, our fearless Zoom techie, is going to put all of us into 3 different Zoom rooms. And in those rooms, either myself or Athena or Jennifer will be kind of walking you guys through a couple of case scenarios using the medical home portal. And here's the catch. We hope that all of you will have access to a device that allows you to get online to ut.medicalhomeportal.org. And from there, you can each individually be kind of searching and looking and browsing and clicking in the medical home portal to come up with information that is helpful to this case. And the information can include content. It can include service providers, which we focus on a lot in this meeting. And it can include what we call resource links, which are other websites that are listed in the medical home portal or downloadable files like a PDF that might be informational, that sort of thing. And so if you'll recall what we did last year when we did the same thing, we looked to see which Zoom room group came up with the most appropriate and relevant resources for that case. So content, service providers, and other resource information. And so that's what we're going to do again today. Athena, Jennifer, and myself will not be pointing you to anything specific, although we might give you little nudges here and there as we watch. We're going to be showing you the cases and we're going to be taking notes. So that's our role here. What Michelle is going to do is she's going to, she'll be in one of the groups so she can record that for our recordings, but she'll also be watching the time, and at the 1 minute mark, she'll let us know that we're going to need to wrap things up, and then poof, we'll be out of those Zoom rooms and we'll come back together and we'll talk about case number 1, and then we'll do it one more time for case number 2. So that's what's going to happen. You'll be randomly assigned to groups. Something to consider, Michelle, is that Ileana and Janet come as a package. So we'll get both of them, whatever room that Zoom registrant gets popped into. Okay, so is everyone ready? Athena and Jennifer and Mindy and Michelle, here we go.
Of the case, and we can kind of read through it together, and then but if each of you can get on the medical home portal site and start looking around for resources, then I'll just plug those into our notes. So let me pull up the case studies, and they are right here. Okay, so the first one is, and these were just brainchilds of our own making. We didn't have any specific people in mind, but the family that lives in Summit County just received notification of a positive newborn screening for citrin deficiency. This is their first child, and they have several questions for their family doctor and would like to know more about next steps. The parents both speak Farsi as their primary language, and mom has limited English proficiency. So any thoughts on where you might, or like what pages of the medical home portal you could lead this family to, either content, service directory, or resource links, or other?
First, take them to the newborn disorders to get more information.
Great.
Well, and I don't even know, like, because it says there's a couple of different type 1, type 2. Looks like citrin is in the type 2, like grouped in with that. So I guess I would want to read that and make sure it made sense and take the family through it.
That's great. I'm going to pop that link in right there. That's the page actually here. I'm going to take notes on a separate screen so that I can navigate to where you guys are suggesting. I think that will. Okay, there. Are you seeing the citrin page? Is that the one you're seeing? Okay, great. I think that's a great place to start. Any other thoughts?
Another area you could do is after a diagnosis or problem is identified under the parents and families tab.
Oh, sure. So if we go to here, after a diagnosis or problem is identified, Anybody else have any thoughts on that? Amalia or Heidi, Julie?
I have a question, Athena. If they have language barriers, what are the recommendations as far as finding help with translation?
Yeah, so there's a couple of different things we could look at in the directory. We could actually look at to see what kind of interpretation and translation services are available for Summit County. And this might, usually the translation services cover kind of a broader region, so we might have to look through here to see if there's some that offer support elsewhere. Like I know we have a couple of online ones.
And they typically
like
have all
Linguistica.
languages that offer international. Okay. All right.
Yeah.
I'm just really new to this. I'm just trying to.
No, this is one that
to learn.
so
So I appreciate it.
Yeah, it provides services through video conference or over the phone. So that's I think that's a great resource. Let's
All
put
right,
that
thank
into
you.
our resource link. Another option might be, for example, if we were back on that content page about citrin deficiency. Whoops. Sorry. Up here in the upper right hand corner, you can see that the page is powered by Google Translate. So let's see if Farsi is the language. I'm pretty sure it is. Oh, of course it's not.
Yeah, I didn't see it in there, and I just wondered what we do if, you know, so maybe use the international link that you provided. That's great. Thank you.
That's interesting. I think we thought we picked one that was up there, so we apparently did not check that very closely. But if you did have a kind of one of those rare languages, you could use that Google Translate to translate the information pages at least. Okay, so we got a couple of good content links. What about anything specific in the service directory or and then some language service? Anything else in terms of like places you might want to direct that family?
You wouldn't want to overwhelm them too much, but you could look at funding for child special needs in the parent and family section, just to see if there's any way you can support them or help them in that respect. And I think it would be, you know, with this kind of disorder, I think it would be good just at some point to help the family with a care notebook, which you could do through the portal as well.
Oh, sure. Yeah, that's great. There's the care notebook. I don't know how it typically works is if someone has a positive newborn screen, what kind of services do they get through a newborn screening program? Is that, would they be connected to any kind of specific services through that, or?
They may be connected with genetics and get a genetic counselor as needed. But otherwise, you know, if it's a screening, their biggest support most likely is going to be their primary care physician in that group, you know, their medical home. Failure to thrive seems like a big part of that. So they might be seeing like GI, feeding clinic, that kind of stuff. So they may be seeing different specialists.
Okay. Are you guys seeing this chart at the bottom? The services for parent, patients, and families. So it does looks like it suggests maybe connecting the family with genetic testing, early intervention, newborn screening services, and nutrition assessment services. Let's go ahead and click on this and see where it takes us. Well, so they would probably have to go to primaries. That's the only it's the only location for genetic services really in the state. Here, go ahead and plug this one in.
Athena, I have a question because I was trying to follow you the same way where you're going, and I was the language option. So I thought it was maybe that I wasn't logged in, but I am logged in. But your page looks different than mine.
Okay, what browser are you using?
Oh, am I using Google? Yeah, that's Google. No, it's Google.
It's Chrome, Google Chrome.
Yes.
Interesting. Do you want to see if you can share your screen for a second, and we'll see if we can problem solve that really quick?
Let's see. Can I share my screen? Yeah, but I'm wondering which one I have. Where is it? Oh, this one, right? Oh.
Yeah, we're seeing it.
You're seeing it? Oh, okay. I thought you were seeing everything else that I have. Like, oh no.
Okay, that's really interesting. Can you click on just the medical home portal page? And then try and select, change your location to Utah at the top. There's a little drop-down box right there. Yep. Change that to Utah and see if that makes a difference. Very interesting. Okay. Well, that might be a little bit of a error on our side we need to look into.
Oh, okay. Because I thought I was doing really good trying to follow everywhere where you're going, and then it's like, I'm lost.
I know, that's interesting. And this is in Google Chrome. Your web browser?
Correct.
Okay. Is everyone else seeing it? Are the rest of you seeing the translate button on your own browsers? Sorry, I should specify.
Yeah, I see it on mine.
Yeah, I see it on mine too.
Okay. I don't know. That's weird. Well, thanks that's a good problem solve thing for us to figure out. All right. Any other I don't know, any other documents, or let's actually just look up Citron in the search bar and see what else it brings up. That might. Okay, here's a few other, oh, I gotta share my screen, sorry. So I just used this top search bar to search Citron to see what it came up with, and it came that page in the newborn disorders that we already talked about. This act sheet, which it looks like it's linking to New Mexico's right now, but if I go to the page, I think it should be linked in here as well. There you go. So this is like a PDF that could be shared. Not maybe the most helpful though for this family since it's all in English. Yeah, I don't know. Any other thoughts on places you'd help or places you'd send this family? Michelle, how much time? Oh, wait, 1 minute. Good.
Yeah.
I was like, I think we're done with this one.
Yeah, I'll give everyone else a chance to wrap up, but I can close the room if unless we want to take a couple minutes, or I mean, just kind of wrap up really quickly.
Here, I'll just show what I have for our notes, and then anybody wants to add anything. So I've got all these different content links for Citrin, after diagnosis, funding your child with special health care needs, the care notebook link, and then in the service directory, I need to look up what this one was, but this was the genetics program. This one was the, let's see. Oh, the Linguistica International. That's right. Okay, perfect.
The only other things I would add is just making sure that they feel comfortable with their pediatrician, and then you could look up the Summit Early Intervention Program to make sure that they have that information.
Oh yeah. Okay, I'll add that one in, and we'll join the main group here.
That was fun. We had a couple little technical difficulties. It was user error on my part, so we got a tiny bit behind. But all right, so Michelle, why don't you tell us which of the 3 break room directors, facilitators should go first?
Athena, are you ready? And we'll start with you.
Sure. So I'll just go ahead and share my screen of what we found. Not big enough for everyone to see.
Yeah.
So the first thing that was mentioned is that we don't know much about citrin deficiency. So starting on the page that talks about, in the newborn disorders, that talks about citrin deficiency, to educate ourselves and our families. And then a few other sections that we thought might be helpful is after a diagnosis or problem is identified in the parent section, and funding your child's healthcare needs in the parent section as well. And then the care notebook at some point in time, probably not right away, but at some point in time, linking them with that as well. And then we got on the question of how to communicate with this family, and I was showing them the Google Translate feature, and we don't actually have Farsi in our list of languages, which is a bummer because that would have been cool to show. But we did find some services that might be helpful for this family, is connecting with like Linguistica International to help at doctor's appointments in particular. So usually, you know, depending on where they go, the doctor's office might have some translation agency that they all work with. And then connecting them with the primary children's genetics program, and then at some point as well, Summit Early Intervention Program also. And that is what we came up with.
Impressive. Very. 1, 2, 3, 4, 5, 6, 7. And and what's mostly impressive is how nicely she's got it all formatted and identified. That's why Athena is.
Athena's just a high achiever. What can I say?
Is.
My goodness.
She is.
I'm very used to doing this, so it's second nature.
Okay, congratulations. Which Zoom room was that?
That was room 3.
Room 3. Okay, very nice. All right, Michelle, who should go next?
Do you want to go next, Mindy? You were room 2.
Sure. Here we go. See if I can share my screen. So we struggled just a little bit at the beginning, and then we finally literally all got on the same screen and ultimately found the newborn screening page for citrin deficiency. So we got that located here under content links. Very quickly, we recognized that interpretation and help with understanding in the primary language was going to be important. And very quickly, we realized that Google Translate on our site didn't say Farsi. So Google came in handy, and we learned that Tajik is actually Farsi, or should work. So we looked at that, looks very cool. So we think that might work. However, we also found probably the same service provider that Athena's group mentioned that could be very helpful. And then Dusty mentioned Boost Lingo, and we searched for that in the Utah Medical Home Portal and did not find it. So we may have identified a new service provider that we need to add. And we quickly looked at the suggest a new provider option that is, we always encourage everyone to take advantage of when you note something like this. We also heard from Tina that the content page about after a diagnosis or problem is identified in the For Parents and Families section of the Medical Home Portal could be very useful. And so we've got that there. And then Tina also, she went a little rogue and she found the page on the Utah Health Department about newborn screenings on citrin deficiency as well. So ours was a little different. We don't have quite the same things, but we did learn about Tajik and Farsi, and we did identify a new potential service provider. So yeah, I'm going to say 6. Also, we mentioned that advice for the family should be to make an appointment with their primary care to evaluate for poor feeding, vomiting, jaundice, lethargy, and I can't say that. And they should be watching for that as well. And then the primary care provider can talk to the family about an appointment with genetics, which all of that was on the newborn page. All right, I'm just watching the time. We're getting a little close, so I'll turn it back over to, I guess, to Jennifer.
Yep.
Okay.
I'll just note things that we found in addition to what's already been mentioned, and I'm just going to see if they come into the, yeah. Sorry, it's kind of formatted poorly, but additional things that we had talked about included like affording formulas. So these special metabolic formulas can be pricey. Working with insurance companies and Medicaid. The service providers. Additionally, we talked about, Utah Parent Center and Integrated Services Program. And then I think there was a lot of overlap with what's already been mentioned. Do you guys remember anything else that really stood out that hasn't already been mentioned?
The other thing is Persian is Farsi as well. So Persian is on the list.
Very impressive. And I bet that the metabolic formula stuff could have opened up a whole conversation about what's happening with formula right now. And my goodness. Okay. All right. Very good.
I have a quick question for the group before we go back. We in our group discovered that some people can't see the Google Translate feature on their page. And so was anybody else having trouble with that? And if so, what web browser were you using? Is everybody
I'm using Chrome and I can see it.
You can see it in Chrome. Okay. Anybody else had trouble seeing it?
And I'm on a Mac. I'm a Safari, so and I can see it just fine.
Okay. Okay. Great. Thank you.
Yeah, that's concerning. So if anyone has more feedback about that, please get in touch with me or Athena. Thank you. All right, Michelle, you want to throw us back into our breakout rooms and we'll go on to case number 2?
Yep, here we go.
Here we go.
We're still joining.
Takes a few minutes.
Okay, so here's our second case. It's a lot more complicated. So it says, a patient who is a 17-year-old boy, they with severe anxiety, suicidal ideation, and headaches is in need of day treatment due to escalating symptoms and school failure within Davis School District. Family has not been able to get the child in for regular therapy appointments. The patient is already on one psychiatric medication. School counselor is concerned that there is not enough support for them at school, and parents are divorced, and the family has both private insurance and Medicaid coverage. So, with all that in mind, where would you start with this one?
There's a lot on this one.
There is a lot.
You could go into, I mean, there's a ton, but like you could go into diagnosis and conditions and check on anxiety disorders and maybe, go through that template on, over with the, review that with the parent and, see what resonates, what doesn't, and look at the like medical conditions causing the condition, make sure that there's nothing that way. They review that information, like, so like under anxiety, it talks about medical conditions causing concern. So you want to just look at the endocrine, cardiovascular, respiratory, metabolic, and neurologic.
Mm-hmm.
Just make sure that they're talking with their pediatrician. And again, you could use the service directory to make sure, like if they need to feel really comfortable and content with their primary care physician. So you could, search up primary care physicians in their area in case, if they did not have a good medical home and they really wanted to switch. So, that's another thing you could do. Make sure that the headaches are addressed. Again, like, is there a neurological issue going on? And do they need to be connected with neurology as a possibility? You can search the service directory. Typically it's going to be about primary children's to make sure that like nothing's going on with the headaches. Under the, you guys just so sick of me talking. I'm so sorry.
No, you're good. I'm just not moving quite as fast as you're speaking. So I'm back on the medical home one, and I was just going to see if there was a pediatric medical home practice in Davis County that we could put in. So Wasatch Peds.
It's a good one.
Maybe.
And so is Grow Up Great. They've got some really good physicians that Grow Up Great and Bountiful as well.
So glad to be on your team, Heather. You're just like all this information in one person.
Well, you're very kind because it's probably annoying.
No, it's
not annoying.
It's helpful. It's years of experience is what that is.
Always worked with really good teams, really cool people. I've been very lucky. The other thing I would go and do is on the parents and family section is it's always important, I think, to look at that menu and look at, is bullying an issue? We see that being such a big issue, unfortunately, for our kiddos. So that's something that I would kind of, just at least touch base with the parents on. And then under that same section on parents and families, you'll see that topic menu about bullying. And then if you go to that same page again, you can go to mental health. And there's, I believe, a section on trauma somewhere that will, oh, there's that on the mental health. You can see the apps to help kids and teens with anxiety. And do you see that?
Yeah, I got that one. The apps.
So I think that would be really good. And then I need to find it. I'm sorry. There's one like that helps with like trauma. And I think we always have to make sure that we're addressing trauma issues. I don't know if I can find it, but it's under the, I thought it was under mental health. Maybe not.
Let's see.
The behavior therapies is another good one to look at and review with the family under mental health. Behavior modifications, mental health. Maybe I need to go back. There's some section on trauma. I just can't find it. Maybe I need to just put it in the.
Yeah, let's search it up here. Let's see if, do any of those look, and you think it was in the for family section?
Oh, it might be the trauma treatment models and ratings. Because like, you know, the ACEs and those kind of things.
Perfect.
And then they also have in the service directory, I think, suicide prevention. And I don't, so if we type in suicide prevention or suicide counseling, yeah. Oh, that's great.
I'll go ahead and put that in. It's just a category. I think it also in a day or in the description mentioned that they are looking for, let's see, I'll just go back to the case study. They're looking for day treatment. So if we search, I think there is also a day treatment, partial hospitalization, maybe. I don't know. I mean,
and they have Medicaid and insurance, right?
Private and Medicaid, yeah. Any
And something that we were thinking about is we typed in also the gender, because it seemed like it said something about them being they. And so we tried, what did you type in? Gender, just gender. Transgender and gender diverse.
So, sorry, I'm having a little bit of a hard time hearing you guys, Ileana and Janet. Oh, just, I think you were saying with the pronouns they use, maybe you're referring to some kind of.
Right, because it had said something about they, and so we were thinking of maybe looking at transgender or gender diverse options too.
There aren't any categories specific to transgender.
We went to the main one and we typed in
a term.
Gender. Yeah, so that's in the articles. On the articles, I think.
Oh, in the article, and this one.
Right.
Thank you. So right here.
Yeah.
Or the frequently asked questions page might even be helpful.
And then down it says services. And we went down to the services.
So at the very end, right here. Good.
And Athena, if they don't have, the Utah Medical Home Portal doesn't have Encircle, ENCIRCLE. It's an incredible program for the LGBTQ community. I don't know if it's in there.
Let's check. There it is.
Yay. Okay.
I'm so happy to see that's on there. I actually volunteer for them.
Of course you do. You're so amazing.
Well, they are such a great resource. They have so many wonderful things.
Okay, so there I see our category. It's under gender sexuality counseling. So that might be where, and I think the pronouns might be throwing us off a little bit because it doesn't say they've identified as transgender. Those would be gender neutral pronouns, right? I'm not sure exactly. I'll be honest, I'm not sure exactly how that works, but okay. Anything else in terms of like, so that we know they're in Davis County, 17-year-old, parents divorced, dual insured. Any other good resources you guys can think of or links that we would want to?
We want to make sure that they're hooked up with the Utah Parent Center because there's school issues.
Oh, yeah. Great. And let's see. And I think there is they have them at each specific school district, right? So for Davis County, there it is. Utah Parent Center at Davis School District.
This kiddo's also 17, so I don't know if he gets more help from school, if Voc Rehab would be, you know, another program that would be helpful for this family, just to help him look forward to his goals in, you know, working as a young adult in the future. If we could bring in, if, you know, Utah Parent Center and Voc Rehab could really support this family.
Yeah, that's great.
We need to head back pretty soon.
Okay, sorry.
Sorry, this was a little involved.
This one was involved. That's good. Okay, I'll stop sharing.
And we can wrap up and I'll close the room. It gives us about 60 seconds.
Okay, perfect. We'll go with what we have. I think that's a good list.
Okay, cool. Okay, so who should go first this time?
Do you want to start, Jennifer?
Sure. Let me pull this up. We'll be fancy this time. Okay, so our group immediately went to try to find more specific supports for somebody who was non-binary. And you know, the transgender, gender diverse youth frequently asked questions popped up. And then we started digging more into different resources that might be available. And we found the Use Transgender Health Program. We did a search for LGBTQ providers for anxiety and Layton, and found Lee Messersmith. And Circle that Tina was just mentioning was a recommended provider as well. Did a search for day treatment specifically under the category, and then went and saw on the map that there was one that was Davis and one that was at the U. And so thought the Davis one in Layton would be the closest, and the team recommended that we should call that location to find out what the wait list time is, so you know how to provide support to the family, because a lot of them will have a wait list. And then the team was mentioning that you could look at staying in home support with kind of this wraparound approach that we were able to find under system of care in the Department of Human Services. And then a resource that was recommended was liveonutah.org. We didn't get a chance to look that up together as a group. And I think one of the comments that was very helpful was to start out by calling the insurance care coordinator and see what options they would cover. So go straight to the like, what are our options, and then work from there.
Wow, very, very nice. I'm impressed.
Good group.
Yeah, the Live On was something that I think has come out recently. So we should double check if we've got that. I'm just watching the time, so I'll go super fast if that's okay, and I won't share my screen. I'll just add what we had. So yeah, nice call on the transgender and gender diverse. I sort of took us in a different direction a little bit. I didn't mean to. Tina brought that up right away. That's great. We also took a quick look at our anxiety disorders diagnosis module, and we also popped onto the FAQs for families about headache. In addition to Encircle, which sounds like it's a good service provider support youth group kind of thing. We mentioned the Utah Pride Center. We looked up residential mental health care, but there aren't great options for this particular young person in Northern Utah under day treatment and partial hospitalization, which Jennifer's group also saw. We found the Davis Behavioral Main Street Clinic, which is a different service provider, but may also be useful. And Tina mentioned that Roz Welch is the Utah Parent Center parent consultant for Davis School District. And so for those school concerns, that they should get in touch with Utah Parent Center. And we also looked up the suicide screening questions, ASQ, which is a screener that could be helpful. That's it. Okay, Athena, how quick can you go?
Super quick. You guys mentioned a lot of what we had already too in terms of like content. A few others we thought of as like bullying. It might be good for the parents to review some of that information, the apps to help kids with teens with anxiety, ABCs of behavior, the trauma treatment and models, ratings. And then a lot of the other thing in service directories we thought too was like making sure that you have a really good PCP and maybe even switching to a medical home practice if they don't or aren't already in one. So we used the category search to look up patient-centered medical home practices, and these were a couple that came up for that area with Wasatch, Peds, and Grove Great. And then we also looked at the category of suicide counseling and day treatment programs, and then the Utah Parent Center at Davis School District as well.
Very nice. Very nice. Wow, super helpful. So we've got like 30 seconds left, and I want to tell you, I learned something every time we do this. I hope that you guys have too. We're going to go back in and double check a couple of things that we heard and saw about the medical home portal. So these meetings always help us to improve that. But we hope that you'll see that there's a lot in there, and it can, we hope, be helpful to you. And if we, myself, Athena, Michelle, can be of help to put something together like this for you when you've got a tough case, we are here. And of course, that's what that listserv is for as well. But if you want stuff specifically out of the medical home portal, we are here, and we are happy to do this with you and for you. So I hope that was useful. Our meeting next month is on June 15th. And I'm delighted to say that Eric and his team, and with the help of Dusty from Summit Pediatrics, will be talking specifically about medical homes and care coordination and patient-centered medical home care. So that should be pretty darn good and very relevant. All right. Anyone want to throw out a last comment before we let you go on to your days? All right. We're setting you loose. It's a beautiful day in Utah. Enjoy, guys.
Thanks for
Bye, guys. Have a good one.
Appreciate it.
Okay. Bye-bye.
Thank you.
Bye.